Let's walk through the world of perioperative nursing, starting with what happens long before the first incision is ever made. Surgery today moves faster, feels safer, and is much less invasive than it used to be, but the preparation nurses provide is still what sets patients up for a successful experience. One of the biggest changes in modern surgical care is the shift toward ambulatory surgery. More patients go home the same day, so much of the preparation happens before they ever set foot in the surgical center. This is where pre-admission testing makes a huge difference. During a PAT visit, the team gathers everything they need: demographics, health history, medications, allergies, consents, labs, and any other required diagnostics. Patients learn what will happen on the day of surgery, and they have a chance to ask questions. Nurses explain how the procedure and the anesthesia may affect the patient's health, recovery, and even their home routines. They also verify surgeon-specific instructions, like bowel preps or antibacterial showers. Discharge planning actually starts here. Nurses look at whether the patient has transportation, who will help them at home, and what support they might need after surgery. Family involvement often begins at this point because they'll play a major role in postoperative care. Perioperative nursing spans 3 phases: preoperative, intraoperative, and postoperative. Each one requires specific responsibilities that help keep the patient safe and the entire surgical process running smoothly. During pre-admission testing, nurses start the work by completing the initial assessment, beginning patient education, verifying needed labs and consents, reviewing advance directives, and laying the groundwork for discharge. When the patient arrives at the surgical center, nurses complete a full pre-op assessment, identify risks for postoperative complications, flag abnormal findings, make sure the operative consent is signed, and reinforce the key teaching points. In the preoperative holding area, nurses verify the patient's identity and the planned surgical site, assess their physical and emotional readiness, review the chart, start the IV, give any prescribed medications, and offer comfort and reassurance. They also communicate any concerns or needs to the surgical team. Inside the operating room, nursing roles shift towards safety and precise coordination. Nurses maintain a sterile and controlled environment, manage equipment and supplies, position the patient safely, apply grounding devices, and ensure accurate sponge, needle, and instrument counts. They document the entire intraoperative course. Physiologic monitoring is constant, tracking fluid shifts, blood loss, vital signs, and taking steps to prevent hypothermia. And even though the environment is technical, patients may be awake at certain points, so reassurance and emotional support still matter. Nurses keep families updated and stay closely attuned to patient needs. Once the surgery is complete, the focus moves to recovery. During the transfer to PACU, the nurse gives a structured handoff: the patient's identity, the procedure performed, the type and amount of anesthesia, their vital signs and response during surgery, any drains or catheters, any blood products given, unexpected events, equipment needs, physical limitations, their preoperative level of consciousness, and the location of the family. In PACU, nurses monitor the patient's immediate response to surgery. They assess vitals and oxygenation, evaluate pain, give analgesics, maintain airway and circulation, administer fluids and medications, offer oral fluids when appropriate, and determine when the patient is ready for transfer or discharge. Once the patient reaches the surgical unit or goes home, nurses continue the teaching, the pain management, the ongoing assessment, and the discharge planning. Follow-up visits help reinforce education and track recovery. Safety runs through every part of the perioperative process. The Joint Commission and CMS update the national patient safety goals each year, with a constant focus on preventing surgical site infections, venous thromboembolism, and wrong site surgery. Before surgery even begins, nurses verify the patient's home medications and make sure that anything discontinued, like anticoagulants or antiplatelets, has been stopped at the right time. This helps anesthesia safely plan the perioperative medication regimen. For example, certain beta blockers taken within 24 hours of surgery improve outcomes, so if a patient skipped a dose, anesthesia may need to address it. Nurses also verify that VTE and SSI prevention measures, compression devices, anticoagulation, or prophylactic antibiotics are ordered before the patient enters the OR. If anything is missing, nurses advocate for the patient immediately. We also categorize surgeries based on urgency. Emergent surgeries are performed immediately for life-threatening issues like severe bleeding, obstruction, skull fractures, gunshot wounds, or major burns. Urgent surgeries should be done within 24 to 30 hours, such as closed fractures or infected wounds. Required surgeries are necessary but can be scheduled, like cataracts or thyroid disorders. Elective surgeries are recommended but not essential for survival, like simple hernia repairs or scar revisions. Optional surgeries are purely patient-driven, often cosmetic. Understanding the urgency helps nurses prepare the patient, anticipate needs, and manage resources. Different populations bring different perioperative challenges. Older adults often have comorbidities and age-related physiologic changes that increase surgical risk. Decreased cardiac reserve, reduced kidney and liver function, and slower GI activity make anesthesia more complicated. A strong preoperative assessment focuses on cardiovascular, respiratory, and renal status. Skin integrity is important too, because fragile skin can break down quickly. Older adults lose heat easily, so warming measures matter. Cognitive changes may appear under stress, so nurses use clear communication, repeat important points, and include caregivers. Written instructions combined with verbal teaching help the patient stay oriented. Bariatric patients face their own surgical risks. More adipose tissue makes IV access harder, slows wound healing, and increases the risk of infections. Joint replacements are more likely to fail with higher BMI, especially above 45. Respiratory issues are common because lying flat can cause shallow breathing, and undiagnosed obstructive sleep apnea is a major concern. Catching OSA early can dramatically reduce perioperative complications. Patients with physical or mental disabilities may need special attention during preparation, positioning, and communication. Nurses ensure that assistive devices are available, plan alternative communication if glasses or hearing aids must be removed, and protect expensive equipment from damage. Safe transfers and positioning are critical to prevent pressure injuries or nerve damage, especially if the patient cannot verbalize discomfort. Respiratory issues related to neuromuscular disorders must also be identified early so anesthesia can prepare appropriately. Ambulatory surgery moves quickly. Patients arrive, prepare, go to the OR, recover, and go home, all within a few hours. Nurses must assess efficiently, explain clearly, reinforce expectations, and plan for safe discharge. Patients and families need to understand the entire flow, from pre-op to OR to PACU to home, and what support they'll need once they leave. Emergency surgery creates a different level of urgency. Preparation time is short, so assessment often happens at the same time as resuscitation. In trauma cases, a rapid head-to-toe visual survey helps identify injury sites quickly. Conscious patients need calm, steady reassurance and clear explanations. When the patient is unconscious, nurses gather critical history, medical conditions, medications, allergies, from family or anyone who knows the patient. The environment is often chaotic, but communication has to stay clear, controlled, and focused.